such a learned people and people who are passionate about yoga. Now I just need to know how many people understand what Parkinson's disease is. If you can just raise your hand. So almost half of the people know about it. But I'll just start with basic, and I would also like you to understand why a doctor with mainstream medicine is interested in yoga when there are medicines to treat Parkinson's disease. I saw a patient last week who was referred by one of the GPs to see me for a neurological disorder, and you will see why I'm interested in looking into yoga. This was a GP referral sent to me, and from the second page you will start noticing the number of drugs the patient is on, which goes to the third page and even up to the fourth. There was some duplication of some of the drugs, but if you discount all that and counting all those medicines, the patient was on 56 drugs, and she's an 82 years old lady. So the problem with modern medicine is that we have subspecialties, sub-subspecialties, and we are so narrowed down and focused with a telescopic vision that we just treat the symptoms of patients when they come to me. Let's say if a patient comes to me for tremor, I'll give him a beta blocker and I'll forget about the rest of the problems. So there is no holistic approach in modern medicine, and that's why patients are suffering. These drugs have drug-drug interactions, they have drug side effects, and patient suffers due to it. So I believe rather than increasing the number of medications, we should look into the lifestyle and other ways of living which can help patients. So I have this small video to show you what Parkinson's disease is. I think everyone knows this man. Is there no sound to the video?
Well, I'm up whether I like it or not, I'm up now. And the other thing that happens to me in the morning, first thing is I get that dystonia, which is kind of cramping, and it can be very extreme.
In a rare interview on ABC, he spoke about the new challenges from something as simple as using a toothbrush.
Because I have to put the brush down on the countertop, hold it flat, and get the brush, because if I hold it, I'll miss it, it's a moving target. But once I get all loaded up, then I just have to bring it up to my mouth and then just let it go.
Remarkably, he also revealed that ice skating appears to temporarily block his symptoms, but only while he keeps moving. There's no cure for Parkinson's, but Michael J. Fox has been fighting to change that. He's gone from actor to activist, campaigning for politicians backing stem cell research, which might offer hope to Parkinson's sufferers. Millions have seen the powerful TV campaign he made a few years ago.
They say all politics is local, but it's not always the case. What you do in Missouri matters to millions of Americans. Americans like me.
Michael J. Fox returns to ABC.
He devotes much of his life now to raising awareness.
Now, recently Michael J. Fox Foundation has given a big research grant to study Parkinson's disease in Australia, and I'm part of that research project, which is conducted from the Kingston Center in Melbourne. So Michael J. Fox has, in true sense, has turned from an actor to activist. Now, just to understand what Parkinson's disease is, it's named by the doctor who discovered the symptoms in 1817 and is named after him, Dr. James Parkinson. But in ancient Ayurvedic text, it's known as Kampavad, which is a more than 4,000 years old treatise. So it was known to old Ayurvedic doctors long time ago. Now, just looking through who gets affected, there are cases in which people can have some hereditary history, but usually it's a sporadic illness, and no known cause is known. The most common condition known in Australia, which is a degenerative brain disorder. As we grow old, there are more chances of getting Parkinson's disease, and 1% of people more than 65 years of age could get affected. The incidence is affected in men and women from all cultures and lifestyles. It's again a non-communicable disease. This is again a small video just to show you how it affects.
Structures known collectively as the basal ganglia. The basal ganglia act as the switchboard for the brain circuits that control movement. One important structure within the basal ganglia, the substantia nigra, produces a chemical known as dopamine. Dopamine is transported to other areas within the basal ganglia, and this enables the coordination of smooth and balanced muscle movement. Parkinson's disease causes the cells in the substantia nigra to die, which results in less dopamine within the basal ganglia. This results in the motor control symptoms associated with the disease.
So this was a brief introduction how Parkinson's disease develops when there's less dopamine in substantia nigra, which is a part of midbrain. This is an autopsy finding. You can see that in a normal midbrain, there is a pigmented area which is known as substantia nigra, but in a Parkinson's disease patient, there is less of a pigmentary deposit which produces dopamine. And as an end stage, you get intracytoplasmic inclusions known as Lewy bodies, which is pathognomic of Parkinson's disease. Now, the main symptoms are the shakes, stiffness, and slowness of movements, and later on, there is involvement of cognition, the balance gets worse, and patients have difficulty in eating and drinking. This is just a small video to show how a Parkinson's disease patient So in idiopathic Parkinson's disease, that's what we call it. Cause idiopathic means we don't know the cause. Patients usually presents with unilateral onset of tremors, which involves one half of the body, and within a couple of years, the other half of the body gets involved. So the tremors are usually on rest. When they do some task, the tremor stops. That's very pathognomic of Parkinson's disease. And the slowness of movements, again, more on one side than the other. So even in this patient, he's more, the part which gets affected first is much slower. So the left side is much slower as compared to the right side in this patient. And as the disease gets worse, the medications, which is mainly the levodopa, which works initially, you have to give more of the doses with less dosing intervals, and later on there are much more complications due to the drug. I'll just keep going. Now, as I said, initially the disease is well controlled with oral medications, but as the disease advances, the medications doesn't work, and you have to readjust the medications. This is a list of some of the medications used for Parkinson's disease. In later stages, deep brain stimulation surgery could be done, which actually involves putting a pacemaker into the deep brain. Mostly nowadays we do it in the subthalamic nucleus, and it is quite effective. In the past, we used to do brain surgeries, pallidotomies, which is no more in use now. Apart from this, we also give apomorphine pump in patients who have quite advanced Parkinson's disease and who are not eligible for brain surgeries, like patients who have a lot of cognitive issues or psychiatric issues. Now, I was looking into Parkinson's disease and whether yoga can help, and I was amazed to see in America there are a lot of centers who are giving specific yoga therapy for Parkinson's disease. The Parkinson's disease patients are not our regular, normal people, so they need a lot of support while they do yoga. Sometimes they have difficulty in walking, so they might need a chair rather than squatting down on the floor, and they might need support of pillows and bolsters to do the yoga. So I was looking through the literature, and in 2002 there was a study performed at John F. Kennedy Institute in Denmark, where they recorded a 65% short-term increase in dopamine levels during restorative yoga and meditation in the test group. There was a recent study done in Mumbai, India, along with the yoga group, and they found that there was a significant improvement in the yoga group in their mobility, flexibility, emotional state, and quality of life. A study done at Neurology and Neuroscience at Weill Cornell, US. It was a pilot study done in 2005, and they mainly found that the effect was good in cognitive dysfunctions such as depression, anxiety, and fatigue in a group which was doing yoga. A study by Hall et al. Published in 2011 last year from UK. It was published in a rehab journal, and it was a single subject design on which they found encouraging results and suggested need to do a study with a larger sample size. There was another study published in 2010 from UK again on mindfulness-based cognitive therapy in Parkinson's disease. This was an 8-week mindfulness-based cognitive therapy course, and this study has indicated that patients with Parkinson's disease could benefit on MBCT, and it's an acceptable form of group intervention. Now, there is a study being conducted in Melbourne through Monash University, and Dr. Craig has developed a very nice program known as Essence, which is a short form of education, stress management, spirituality, exercise, nutrition, connectedness, and environment. This is a 6-week program which covers all the above aspects for a healthy lifestyle in Parkinson's disease patients. This program has been used in a wide range of chronic conditions in the past. So I am one of the members in the advisory committee, and we are having a really good number of patients in this study. Now, any yoga program actually has 3 components to it, which include breathing, postures, and meditations. Breathing is the pranayama, postures are asanas, and meditation is the dhyana. I think we have covered all these 3 topics in other lectures throughout the day. Now, pranayama is good because then you have control on your breathing, and then you notice that stress is less when you are aware about what's happening to your body, and response can shift from fear or anxiety to take the control of your body. According to the Parkinson's Research Foundation in US, controlling your breathing doing pranayama helps in moments of panic, especially in Parkinson's patients when their feet stick and they can't walk and they have hesitation in walking. Then just to have more awareness about walking can improve it. Now, mainly there are 2 types of pranayams which are quite effective. One of them is Anulom Vilom pranayam, which you all have done this afternoon, which helps to control tremors and abnormal body movements. Even in my private practice, I tell my patients who have benign essential tremors, which is another type of tremor which is benign, not unlike Parkinson's disease. That tremor comes when patients try to hold on something in their hand and they start shaking. So Anulom Vilom pranayam actually helps in that condition also. Other breathing exercises like Kapalbhati helps them to be more alert during the day, as daytime drowsiness is a known problem with Parkinson's disease. Now, there are different asanas, and I had a list of all those asanas at the end of the slide, but they all help to improve the balance, posture, and other problems in Parkinson's like constipation. Stiffness in the body is a main problem, and all the restorative twists and poses with these asanas help with Parkinson's disease. Now, the meditation, there are studies done in US, and they found with meditation there is an increase in the striatal dopamine levels, and I believe that also would help with patients with Parkinson's disease. So meditation definitely is part of any program for Parkinson's disease yoga. Now, just at the end, I think if people with Parkinson's disease embrace yoga, they might need less amount of drug, and as you all know that drugs causes side effects. Even in that video of Michael J. Fox's, dyskinetic movements were secondary to the dopa-induced dyskinesias, but which is inevitable if you have to get the improvement. So yoga has much to offer to patients with Parkinson's disease as to a normal patient, and it improves motion, strength, awareness of the body, balance, mental focus, and brings peace to the mind. So this is some of the list of the asanas which I have gone through with my patients, and we are planning to do a 6 weeks program with help of Parkinson's Victoria in Melbourne for Parkinson's disease patients. Thank you. Thanks, everyone.